Welcome to the ASH Advocacy Training Webinar. My name is Belinda Avalos, and I'm the 2025 ASH President, and I'm a Senior Leader at Atrium Health Levine Cancer in North Carolina. Advocacy is a really important aspect of what we all should be doing, and even more so during these times. You're here to join us and learn how to make your voice more impactful on research in hematology and on patient care, whether it be classical or malignant hematology that you see patients with. Next slide, please. I have no disclosures. Next slide. And so what I'm planning to do today is first present an overview of our new hashtag Fight for Hematology campaign. And then that will be turned over to I'll turn things over to Michaela Hollis and Grace Kranstover from CRD Associates, who will give you the Advocacy One-on-One training course. And that course is going to be instrumental in helping you have a bigger voice in what we do as hematologists and whether we're clinicians or scientists. And then this will be followed by Susie Leas, who's ASH's Chief Policy Officer, reviewing ASH's current policies and priorities. And then we'll conclude with a question and answer period. Next slide. So, as many of you know, in response, there have been sudden and massive cuts to federal research grants, training opportunities, and all federal programs by the Trump administration. And ASH has invested more than $12 million to help support critical research and protect the pipeline of hematologists. And as part of the commitment, ASH has increased award funding by roughly $9 million to support more than 600 additional awardees, bringing ASH's total awards commitment to more than $20 million over the next 12 months. The significant investment in awards that ASH has made is just one component of a multifaceted approach to research and regulatory challenges to hematology priority, which is a new strategic priority of our society. And this includes increased advocacy efforts, sharing your story, amplifying ASH's voice, and donating to the ASH Foundation. And the donations will help us continue to support new awards, which include awards for mentorship, for research projects, and for more Bridge Grants awards. So these awards span the spectrum from medical school to faculty level, and retaining and recruiting hematologists or individuals into the field of hematology is really an important effort for ASH and should be for all of you who are joining us today. So as you can see, there's a QR code, and if you click on the QR code, you can see what is in store in our Fight for Hematology campaign, and together we can really drive meaningful change in hematology. So thank you all, and I'm now turn things over to our CRD Associates. Next slide.
Hi there, my name is Michaela Hollis. I'm a Vice President at CRD Associates, and we're policy consultants to ASH. I have no relevant relationships to disclose.
Hi, everyone. My name is Grace Kranstover. I'm also a Vice President at CRD Associates, and I also don't have any relevant relationships to disclose.
All right. So first, I just want to say, first and foremost, thank you for your willingness to participate in advocacy. If you're here, you have an interest in advocacy, and that's great. taking it back to the basics, advocacy is really about taking action to support a cause that you care about. And it can be as simple as sending an email to your member of Congress or as involved as participating in a face-to-face meeting. And for ASH, advocacy is a key tool to influence policy in ways that benefit patients, providers, advancing research, supporting hematology in the workforce. And ASH really advocates in an open and transparent way, always focused on ensuring that ASH members' voices are heard. If you can click to the next and keep clicking through. We've got some examples of advocacy here. Patient advocacy, sharing patient stories, grasstops advocacy, leveraging ASH leaders, legislative advocacy, advocating directly with members of Congress, regulatory advocacy, engaging with federal agencies, grassroots advocacy. That's all of you encouraging ASH members to advocate. Coalition advocacy is working with like-minded organizations. And then, of course, social media advocacy, really leveraging social platforms for advocacy. Next slide. And so why should you advocate to advance hematology research and care? So first and foremost, raising awareness. Policymakers aren't super familiar with all of the realities of living with or treating blood disorders like sickle cell disease, hemophilia, et cetera. So advocacy really puts a human face to the statistics, making these conditions and these issues that you all care about visible and urgent. And sharing patient stories and your perspectives as hematologists really helps members of Congress and their staff understand the real world impact of their policy decisions. Next, enhancing education. Hematologic conditions can be rare and even misunderstood. To many of you, it can feel like, basic knowledge, but to the average person, it can be complex. So education really helps to correct some of the misinformation and build support. And advocacy helps inform not just policymakers, but the general public as well. So the more people who know, the more likely they are to support, innovative screening and treatment methods, or advancing care and funding for research and prevention and those sorts of things. So it's really about that education piece as well. And then improving outcomes. We have seen that federal investment in research can lead to new therapies and cures and better quality of life for patients. Advocacy can really ensure access to those treatments and care. And so, the work that you do through advocacy can also improve outcomes as well. But I think probably most importantly on this slide, I think it's important to understand what your why is. Why are you advocating? Whether you're a caregiver, or patient, or provider, or researcher, your voice really matters. And I think before you get involved in advocacy of any kind, it's important to really think about what drew you to this work and what inspires you to advocate. Maybe it was a patient you cared for early on in your career that you still think about to this day, or maybe it was a family member or a friend that you lost, or maybe it was your own personal experience and your own challenges you faced in the healthcare system. Really thinking about what your why is what will make your advocacy personal and powerful and also unforgettable. Next slide, please. So kind of wrapping up that last slide, going into this one, the benefits of advocacy: you get to amplify your voice through sharing your story. You really don't need to be a policy expert. Your lived experience and the lived experiences of your patients are very powerful. You can influence policy. Advocacy puts hematologic issues on lawmakers' radars and really, really does help shape policy outcomes. And enhancing awareness. Many people, like we said, including lawmakers, don't fully understand the burden of blood diseases and disorders. And so you are enhancing awareness through your advocacy. And then also building relationships. It's not just about one meeting, it's about really creating those long-term connections with decision makers. ASH has seen through our experiences that a strong relationship with congressional offices means that they will come back to you at some point when making policy decisions that affect issues related to hematology. And so building those relationships is a key component. Next slide, please. And now I'm going to hand it over to Grace.
Thanks, Michaela. So advocacy can take many forms and be done by an individual or in a coalition with others, and each type really has its own benefits. Individual advocacy benefits include flexibility, creating targeted or tailored advocacy efforts, being able to develop one-on-one long-term relationships with staff or lawmakers, like Michaela was just referring to, and getting to share your own personal experiences in a more intimate setting, you could say. However, coalition advocacy is also beneficial, and we know that there is strength in numbers, and that a united front can also help raise visibility for a cause, and also allows organizations to pool resources together. ASH is part of various coalitions that together work to help advance mutually beneficial advocacy issues, such as protecting Medicaid or increasing funding for agencies like the National Institutes of Health. Next slide. So with these two forms of advocacy, there are several different ways individuals and coalitions can take action to advocate. Individually, folks can make phone calls, send emails, attend virtual or in-person meetings. They can participate in town halls and make their voices heard on social media. One great way of not only advocating for an issue, but also educating members of your community on a topic is writing and submitting op-eds or letters to the editor in your local news publications. Here in DC, many folks may not know, lawmakers often receive their local newspapers from their districts and states. And so op-eds and letters to the editor are often a great way for your issue to be read or seen by your representative or senator who may be deliberating on a stance on a particular topic. And I'll also just highlight, in coalition, groups will often band together to coordinate and participate in Hill Days. So again, it's that pooling of the resources I just mentioned. Coalition and coalition-led advocacy also, you'll see groups develop and send coalition letters and create campaigns around shared topic areas. Next slide. So ASH has just published a new letter to the editor toolkit on hashtag Fight for Hematology, hashtag Fight for Hematology Action Hub. As I mentioned just shortly ago, letters to the editor are a great way of bringing attention to an issue of importance. And again, not just to your local leaders and federal lawmakers, but also to your community. The toolkit that ASH has created aims to give hematologists guidance on how to influence policymakers, local leaders, individuals in your community through timely and well-written letters published in media outlets. So check out the toolkit today for tips and examples of letters to the editor that ASH members have written and to be able to submit yours. Next slide. So now that you've learned a little bit about the different methods of advocacy, how can you get involved and how do you identify what method is best for you? Well, first of all, remember that all methods of advocacy are important, but I think perhaps the most important is choosing whatever method is most comfortable for you. So this could be sending a simple email or making a quick phone call to your lawmaker's office. Overall, you want to choose whatever you can dedicate the time to. We know that there are different levels for everyone. ASH staff are also always available as a resource, not only to help you identify your advocacy goals and priorities, but also to answer questions about ASH's priorities and advocacy in general. So don't hesitate to reach out. Identifying and getting to know your member of Congress is also key. And as part of that, so is preparing and clearly being able to articulate your points. More on some tips on how to tell your story soon, though. And of course, you always want to remember to thank lawmakers and their staff for their time and find ways to follow up. So again, more on that a little bit more. Next slide. So being an effective advocate isn't as hard as it sounds, but it's important to be an informed advocate. This means having an understanding about the issue you are advocating for and knowing who your members of Congress are. And this can require a little bit of homework. For instance, you may want to look up your member of Congress's website. Do they have any leadership roles in Congress? Do they sit on any committees or subcommittees that oversee issues that are important to you or ASH? Signing up often for their email newsletter or following them on social media platforms are also a good way of getting to understand their positions, thought process, not just on hematologic related issues, but on a variety of topics. Next slide. And again, ultimately, I'd say communication really is key. Remember that while you are the expert, you have that lived experience, you can speak to the experience you have seen and that your patients have experienced. It's also important to keep your message clear and simple. Avoid technical speak and using acronyms that staff may not be familiar with. And level setting with anyone that you talk with is also important. Ask, do you know what hematology is? Are you familiar with hematologic research that NIH conducts? Are you aware what sickle cell disease is and how it affects people? Asking those simple questions is a great way to begin a conversation and build those relationships that will hopefully ultimately support your cause. But overall, be persistent and proactive. And now I'm going to hand it back to my colleague, Michaela.
Thanks, Grace. So now I'm going to talk a little bit more about telling your story and how to tell your story. And I think when you think about how you're going to tell your story, it's important to kind of go back to what I was saying earlier about remembering your why and why you are advocating and just, remembering your story and what has brought you here. We always say that the most effective advocacy combines data and personal stories. So your job really, when you meet with your members of Congress and their staff, is to let them see the human impact behind all of the data and policy proposals, and really leave your members of Congress and your staff and the staff that you meet with something to remember. Next slide, please. So when you're telling your story, remember that you are the expert, and I cannot emphasize this point enough. Us Washington folks on the CRD team and the ASH team, we can go to the Hill all the time and talk about policy and all of the nitty gritty of policy proposals, but we can't do it in the same meaningful way that you can. You really have the personal experiences, the personal stories, the expertise that really localize these issues and make it personal. And so as a hematologist, it's important to describe your journey, how you got where you are, share how you and your patients are impacted, make it personal and keep it focused. It's important to localize your impact. That's why we want you all to do meetings back home in your district and your state. It's important that members of Congress really understand how this issue affects people back in their home and in their state. Localizing advocacy is incredibly important. And then, of course, back up your stories with data and specifics. Show that it's not just your story and what you or your patient may be experiencing, but it is part of a broader need or problem. And then, of course, be concise, but also memorable. After making that ask or landing the plane, as I like to call it, you really want to make sure that you leave some time for dialogue, questions, and kind of a conversation with the member of Congress and their staff as well. Next slide, please. So kind of giving you some tips on how to tell your story. Now we're going to give some examples of an effective way to advocate versus ineffective, and we're using Medicaid and NIH as an example. So I'm going to take this Medicaid slide, and then Grace will jump in after to give an example for NIH. So on the left side, you'll see this is our example of effective advocacy. So this includes a clear and concise ask. So when we think about Medicaid, you know, you want to start right off. Thank you for the time to meet with me today. You know, I am here from Louisiana. I'm just going to pick on Louisiana for a second to urge you to please oppose cuts to Medicaid, which are driven by work requirements and more frequent eligibility verifications to protect patient access to care for individuals with hematologic diseases. Next up, you want to make sure you make that personal connection that we just talked about a couple slides back. Explain how Medicaid provides coverage and access to services for patients with hematologic diseases. This is where you can share that story. You know, Medicaid is a lifeline for people. And let me tell you about my patient from Louisiana, a young man living with sickle cell disease. He grew up in a rural area in Louisiana where access was limited. And thanks to Medicaid, he was able to see a hematologist regularly and access pain management services and receive treatments. And without that coverage, his visits would have been, his emergency room visits might have been more frequent, and his condition may have worsened. You know, really, without giving too much patient information, being able to share that personal story will really leave them with something to remember. Again, you know, making that district state impact, not just sharing a personal story about someone back in your state, but combining that personal story with data. So coming armed with information on the Medicaid coverage in your state. You can tell the staff person or the member of Congress, did you know that Medicaid covers from 31 to 45% of people in Louisiana's congressional districts, giving them that data that they can bring back to their boss. And then, of course, always stay focused and on message. Let them know that cuts to Medicaid at the end of the day will harm the health of those with sickle cell disease, blood cancers, and other hematologic diseases in Louisiana. And then, of course, we want everyone, not just ASH members, but everyone who goes to the Hill to remain, you know, polite and have a professional conversational tone, respectful, even if you may not agree with that member's policy positions. We want to make sure that that the conversations are respectful and professional when you meet with members and their staff. So now I'll hand it over to Grace to give an example of NIH.
Thanks, Michaela. That was great. So as Michaela said, the same can really be done for the National Institutes of Health. And I'll start with like an example of an ineffective advocacy message. And so I'm going to pick on Florida because that's where I grew up, but you know, that may sound something like this. Hi, my name is Grace and I live in Florida, and I want you to support research funding. Investing in research is important because it saves lives and it helps people develop better treatments. I really need you to support funding for research and stop fighting with members across the aisle about this issue. So that's an ineffective way of advocating for NIH because it's vague, right? I don't provide some of that personalized connection to the issue. Don't really say where in Florida I'm from. I just name a state. I start to bring up the partisan topics and like, I really need them to get their act together and advocate for this issue and stop fighting, right? Versus, again, taking some time to think about some of your connection to the topic at hand and thinking about how does NIH relate to me, right? In that example about ineffective advocacy, I didn't even mention, you know, I'm a hematologist. I work with patients that have benefited from hematologic research. So an example of effective advocacy might look like saying something along the lines of, hi, my name is Grace, and I'm here today from Boca Raton, Florida. and I'm asking you to please oppose any cuts and illegal impoundments to NIH in order to protect innovation in hematology. So right away, clear, concise ask. Then I might say, I am a hematologist at my local hospital treating a number of patients with rare hematologic diseases like acquired hemophilia. Our hospital has received a $3 million grant to research effective treatments and the cause of acquired hemophilia. Through this research, we've been able to study the possible causes and why the body produced antibodies that attack the body's ability to clot, as well as better treatments that have helped improve quality of life for several of my patients and have saved them and the hospital millions of dollars. So again, connecting what me, if I were a hematologist, my work, my research to this issue, how it's benefiting my patients and therefore a lawmaker's constituents, and being able to connect that directly back to my ask is really important. That really gets into the district and state specific impact. So then I might close by saying, this would not be possible without the National Institutes of Health and the federal investments from Congress. I therefore ask that you oppose any cuts to NIH and protect innovation in hematology. Failure to do so would only slow down our research efforts and hurt patients like mine. Thank you. So again, clear, concise ask, remaining polite and professional, and focused on the message. So emphasizing that NIH cuts will only slow down innovation and hurt people. Adding in that personalized message about your connection to the issue, information about how funding is making an impact at the local level, and keeping that ask focused and clear really can make a huge difference. And let's go to the next slide. So we hope that this information on how to be an effective advocate for hematology has been helpful and that perhaps it's inspired you to take action. ASH's members are really uniquely positioned to help increase awareness and education about hematologic conditions, but we really cannot achieve our goals without your help. So I'm now going to turn it over to Susie to provide an overview of what issues ASH is currently focused on. Thank you.
We need you to take action. And on ASH's website, we have an advocacy action center. If you go on the QR code, that'll take you directly to our action center. And we have a number of ways where you can help us with that advocacy. You've already taken the first step today by joining this webinar, which we're grateful to. But if you click on, we have these letter templates that all you have to do with a click of the mouse is type in your name, your zip code, and your congressional delegation will pop up and you can send a letter. We have a template there and you can edit that template to talk about the work that you do when you're talking about NIH cuts or talk about the care you're providing to patients who have Medicaid. And it is so important to let members of Congress hear about your concerns. And this is a really simple way to just send a letter up to Capitol Hill. And those letters count. I worked on the Hill. I saw those letters. I informed my boss about what I was hearing from constituents. So the volume, the pressure is so important. We have an advocacy toolkit, which includes lots of things like sample scripts when you call your member of Congress, sample social media messages that you can send out. We really need to really amp up and get lots of ASH members helping us to advocate. If you have questions, and one of the things we want to ask you today is to help us with district visits. While we are here in Washington and our Committee on Government Affairs and our ASH Committee on Practice come to Washington, and our ASH leaders, including Dr. Avalos, come to Washington and visit their members of Congress and other leaders up on Capitol Hill, we feel that now, giving this time of NIH cuts and potential cuts also to Medicaid, that your members need to also hear you back home so we can help you. ASH staff will help you to set up a virtual call or a meeting in the district. Members of Congress are back home Mondays, Fridays, during probably the July 4th recess, during August recess. So there's lots of time to connect with them and share your stories, share that important story about the work that you do. So email us at grassroots@mail.hematology.org if you'd like to help us advocate back home in the district, or if you need additional advice. We have so many resources here, our fact sheets. We can give you the background of the member of Congress, etc. But really, what I'm asking you today is to help, to reach out to ASH staff. We're here to help you. And we need to get to all states, red states, blue states. Every member of Congress needs to hear from you. And again, really need to help you advocate for us. So we hope today has been very helpful for you to pick up some tips of the trade. And again, we're here to help.